we just finished up our seminar, our regenerative medicine seminar, and I think the viewers out there in internet land need to know. They probably have questions, some frequently asked questions. What do you both hear from patients when they come in? What both on the phones or after the seminar? What are some of the questions that people are concerned with?
Probably the number one question that I get would be, of course, does it work?
Does it work?
Does it work?
Yeah, and that's, hey, my big thing is we wouldn't be here if it didn't.
Absolutely.
I mean, it across the board, you're seeing reports from clinics like ours, orthopedic clinics, regenerative medicine clinics, 80% success rate, and I think ours is approaching 90% because with our rehab blended in with already successful stem cell therapy treatment, we get more out of those stem cells than other clinics are doing. And we all know of other smaller clinics or even the bigger established orthopedic hospital that are doing this. It's shocking how there's no rehab. There's no rehab involved. Or they tell them to go to the pool and walk around in the pool and
stuff to do at home.
Yeah, or at home. And I mean, there's no concerted effort into keeping those stem cells active and healing. And
so they may not even reach like their full potential.
Absolutely. Right? And the older you get, the less healthy you are. Those stem cells are going to need more help than someone who's younger or in good shape. And I think we do a good job of getting that out of them, getting the full benefit from it.
And a lot of people are scared it's going to hurt.
Yeah.
They don't actually know, what type of procedure.
Well, I tell you, it's a simple injection, but people are used to cortisone injections, and those things hurt like the devil, and it just doesn't hurt like that. Gosh, I can't remember the last time we had anyone who had any complaints. Of the stem cell therapy or the allograft therapy, I should say.
Right.
That's another thing too. I want to. Because I slip up and call it the wrong thing all the time. The FDA, their specific terminology for stem cell therapy is stem cells that are gathered from the person's own body. What we do, of course, is the allograft therapy that contains stem cells.
Right.
And that allograft is gathered from the placenta of a mother has her baby. She donates the placenta to the lab. The lab then isolates those stem cells. I think that's another big question that I get asked a lot is where do these stem cells come from?
And is it aborted babies?
It is aborted babies. I tell you what, man, that's...
Do they get these stem cells from aborted babies?
I tell you what, if that were the case, we would definitely not have anything to do with it.
Absolutely not.
Absolutely.
And it's illegal.
And it's illegal. Yeah, it has been since the 80s. There's no abortions have anything to do with the current stem cell manufacturing. They come from tissues that would have been thrown away anyway. The mother has her baby, instead of throwing away the umbilical cord and the placenta, it's donated to a lab that can then safely harvest the stem cells and other healing cells from there, and then package it into a easily administered product.
Right. Which brings us to another question everyone asks is how many stem cells are you getting per cc?
Well, that's an easy one to answer. But roughly, with regenerative labs, it's roughly 500,000 or so. 490,000 to 525, I think, was the lab count. They actually have somehow to count all this, all the cells in there. And that's amazing. And I tell you, the other thing is the exosomes, because the exosomes are in the billions. We're talking 10 billion per cc. So if you get a 5 cc vial of it, you're talking 50 billion exosomes. One question is, what's the difference between an exosome and a stem cell?
True.
So the stem cell, and I always go back to dairy cows. I hope this is, we're in the South. So if the stem cell is a dairy cow and the exosomes would be the milk that comes from it. So
the secretions.
That's the secretions of the stem cell is the exosome, and the exosome is what does the work. And so I tell people you could either, buy the cow and have that cow produce milk for you. That's like getting a stem cell or the allograft injection, or you can just get the milk.
Right.
And that's the exosome treatment.
But it also depends on the problem.
Oh, absolutely, yeah. We're getting more and more people at the seminars, it seems, that have health issues, not just injured
joint problems,
like
knee,
autoimmune
problems, And that's, the FDA is real clear about this. You can't say that exosomes treat any one thing because
Right.
it's not a drug. It hasn't been approved to do these things. But what I tell everyone, these things don't cure you anyway. Your body, the best thing you do, your body cures itself, like you just said.
Right.
And these things can help that happen.
You brought up the FDA. A lot of people, they'll ask, is it FDA approved?
Right. Yes, good question, Jessica. The FDA, what they do is guarantee the labs that that harvest the stem cells and the labs that harvest the exosomes are following guidelines. They're following procedures that ensure their product is clean.
Right.
Because the stem cell is not a drug, the exosomes are not a drug, the FDA doesn't regulate, doesn't say, hey, this is approved, because it's not a drug.
Right.
But they do, they absolutely guarantee that those labs are following cleanly procedures and what and regulated, and that they're putting out a good product. And they have systems in place to find any kind of, possible contamination or things that could go wrong. And to date, there's been no deaths associated with stem cell therapy. There's been no serious injury associated with stem cell therapy or the allograft therapy that we use. And that is one distinction. I keep saying allograft. And allograft simply means that you're taking a tissue and grafting it in your body. And that's the type of product we use in our clinic. Instead of using your own old stem cells,
Right.
because after you get about 40, your stem cells kind of get lazy on you. And unlike Europe, you can't take out your own stem cells and doctor them up in a way that makes them young and more effective. So you're kind of stuck with whatever you got.
Right.
So the more unhealthy you are, the more, the older you are, the less effective your own stem cells become. So that's where the allograft really comes in handy.
Right.
What other questions do y'all hear?
I guess cancer. A lot of people ask about cancer.
Cancer, yeah. So stem cell therapy, exosome therapy, they don't cause cancer. They don't make it more likely for you to have cancer. But if you are fighting cancer, you wouldn't want to do anything to make the environment of the cancer better or make the cancer grow more. And stem cells do make things grow, so you don't want to be battling cancer and do stem cell therapy at
Right.
the same time. The other issue is if you had to get chemotherapy, the chemotherapy could very well wipe out and kill
The stem cell.
stem cell. So cancer is definitely a hard no as far
Right.
as the treatment is concerned. That is a contraindication.
Right. Another could be, it kind of goes by, I guess, your response to the FDA, but why is it not covered by insurance, and then the cost of it?
Yeah, so it isn't covered. And so the why isn't covered by insurance that's really goes back to insurance companies, and I think whether you're a natural doctor or whether you're just a typical MD who does drugs and surgery, no one is happy with insurance. And we've seen great procedures like rooster comb injections, the hyaluronic acid injections for knee arthritis, cut for no reason other than the insurance company's greed. So I will preach out against insurance companies. They don't cover the things they need to cover. They don't cover preventative. And one of the easiest things they could do would be to cover weight loss. That would
for
save you
sure.
from heart attack and stroke and all these, disabling diseases. They don't even cover that. So insurance is so broken. I think we just need to scrap it and start over. They not only do not cover stem cell therapy and allograft therapy, but there's a whole host of things they should be covering
That they don't.
because they just don't want to take responsibility for. They want to make money but not have to spend it.
Right.
It's kind of what it comes down to.
Think about the people that come in that have had knee replacements that want stem cell.
Yep.
And you can't.
And you
There's
can't do
nothing
it.
you can do.
There's
Once
nothing.
you have that knee replacement, we can't do stem cell. We
Right.
could, but it would be a waste of money.
Right.
Got
Got a bionic knee.
and they got that knee, but it still hurts them.
Exactly.
And
There's so many risks with surgery.
Yep.
tons of risk. Roughly one out of every 400 patients dies from a total knee replacement, from usually a deep vein thrombosis or some other complication. Infection is another big one. Every other seminar we have someone that gives their negative testimonial of
Right.
how they tried to get a joint replacement and ended up getting an infection.
Right.
Almost killed them.
Yes.
That's something you just don't see with stem cell. People are so concerned and they should be concerned. It's always a good idea to be concerned about any medical procedure. But I find that they are so overly concerned that stem cell therapy is going to somehow hurt them, and they don't realize that even ibuprofen kills 17,000
More
people a year.
dangerous.
If stem cell therapy killed 2 people a year, no one would do it. It would probably be banned, but yet ibuprofen, people don't think twice. They'll give it to their kids.
Take it 4 times a day.
Take it 4 times a day, way
Yep.
past what they should, and they don't realize that that's what's endangering them, not the stem cell therapy.
And causing more health
and
problems.
Causing more health problems.
Yep.
That's another thing too. People don't realize that cortisone therapy and these NSAIDs
Oh, yeah.
are making the problem worse.
Right.
And this is, you can Google it.
Right.
It's not hard to find the evidence that shows these things are making your arthritis worse.
Right.
It's not fixing it. It's making it worse. And now patients actually have an option to really reverse this damage done by, both aging and the drugs that they've
Right.
been taking.
And then
And-
surgery's
yeah.
always an option afterwards, like if you've tried everything else.
Right. And it's exactly right too. Once you get surgery,
There's no going back.
there's no going back. Oftentimes you can't do stem cell therapy, but at least with a replacement surgery. But if stem cell therapy for some reason didn't work out, you can always go and get surgery. And that's the way it should be done. It should be prevention. Then if prevention fails, stem cell therapy or regenerative medicine therapies, and then surgery last.
Right.
That's
kind of what I find myself explaining to a lot of patients. Your ibuprofen, your medication, cortisone, even some surgeries, it's just a Band-Aid. We're just
Yeah.
covering up a problem.
That's right. Even
We actually have a goal to fix the actual problem, not just cover it up.
cover it up. That's
Yeah.
exactly right. Because that's all medicine is for the most part, is just a big cover up.
Right.
Whether you're talking, it's just a chemical cover up. People feel better, but they're
Right.
not really better.
Exactly.
And this is actually strengthening the tissues, correcting the tears, the damage,
Right.
making their joint younger.
And then thinking about opioids, how many people are getting addicted to
Oh,
opioids
gosh.
from taking these medications every day just to get out of pain?
It's rare to find a family now not affected by opioid use.
Right.
And it's just a travesty that this has been allowed to go on so long. And it was caused by the people we look up to, the doctors, the pharmaceutical companies, people we trusted
Right.
to make the right decisions for our health. And now a huge percentage of the nation is addicted
Exactly.
to drugs and turning to illegal drugs now that they can't get what they used to get from the doctor's office. Now they're turning to heroin and all
Exactly.
these terrible drugs and just what a mess.
Big mess.
that-
And it's covered, some of it's covered by
It's still
insurance.
covered by insurance. What a crazy situation.
Yeah, for sure.
It is nuts. So what other things? I know you guys wrote some notes here that
Well, a lot of people, after they get the stem cell injection, they want to know how long it will be before they see any improvement.
see any
Right.
improvement. Well, I always share my testimonial during the seminar. It took me about a month. My neck was badly injured in a surfing accident. Cool story. Check it out on the on the video. But from the time I had it done that night, the soreness really kicked in for me, and it felt like I'd worked out too hard in the gym, and my range of motion was limited. First thing I noticed as far as improvement goes, I noticed the nerve pain got better. I didn't have any more shooting pains down my arms and fingertips, and I didn't have my muscles weren't spasming for no reason.
Right.
And that happened probably in 2 weeks. But then the real pain in the neck itself went away, and probably in about 3 to 4 weeks, it just disappeared. One morning I
better.
woke up pain-free, and
Right.
man, I was thanking God.
Yes.
Worked, and I've been pain-free ever since. It's been over, a year and a half, I think.
Yeah.
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 Yeah, I think so.
And
Which
not a-
goes,
and I'm able to lift weights. I'm able to work, and as a chiropractor, very physical job.
Active,
Moving people around, and not a bit of problems from it, and no drugs, no surgery, just
Right.
the allograft.
so the next question that could lead to is how long does it last?
How long does it last? Well, hopefully that tissue will last as long as you do. Now it does depend on your activity levels. Like if you're a marathon runner and you use stem cell or allograft therapy, you regrow some cartilage in your knee, but you're putting 100 miles on it a week.
Right.
It's going to wear out faster than someone who's just got a normal 9-to-5 job and doesn't run all the time. But in general, it should last you as long as you last.
As long as you last, right?
Now, we've had a few patients that had unique injuries. They're in their 20s. Theirs may wear off down, 20, 30, 40 years down the road. Perhaps they would need a new stem cell or allograft therapy. But hey, surgeries only last, what, 7 to 10,
10
15,
years,
7
yeah.
to 15 years of,
Yeah.
of a knee replacement. This beats the brakes off that.
Right.
So, it's compared to the alternatives, you're getting great outcomes, great outcomes.
And then people ask, how do we know we're going in the right spot?
How do we know we're going in the right spot? Well, your clinic, folks out there in internet land, make sure your clinic uses guidance, either a fluoroscope. Yeah, well, typically, if you're in the joint, you need a fluoroscope.
Right.
Some clinics use ultrasound guidance. They're just not. It's not the gold standard for the joint. And oftentimes, these clinics have gone to a weekend class, and they have no clue what's on that ultrasound screen. Nor do you. You don't either. And so you're just trusting that they're in the right spot. Often they're not. With a fluoroscope, you can literally look on the screen and you can make out your joint, your knee
Right.
joint, your spine, and you can see the
See
needle,
the needle.
Exactly.
in the right spot.
Right.
I mean, it's that simple, and there's no doubt. But for that, you got to have the facility. You got to have a room lined in lead, which is not cheap. The equipment itself is incredibly expensive, tens of thousands of dollars for these machines. And then you have to have the right training and then the right experience. Gosh. We've learned, I mean, we've been doing this for how many years now? We're going on 4 years. Been doing,
Yeah.
that's just allograft therapy. It's been the last 4 years. Of course, we have been seeing people in a natural medical, doing natural injections even before stem cell
Right.
therapy. Gosh, we'd helped, before we even started stem cell therapy, I think we'd delivered tens of thousands of injections. And so we know our stuff
For
when
sure.
it comes to where to put the medicine. So,
Right.
as far as the price goes, people always go back to price, and I get it. It's a lot of money. They want to be sure that it works. And what I find is this: people don't mind spending the money when they're certain they're going to get a result.
Right.
Right.
And so we try to make that person as certain as possible by giving them everything that we know
Right.
that will work to help those cells heal their body as best as possible, and that comes down to our rehab program.
For sure.
And I think that's really what separates us from other clinics. Most places are going to charge you extra. Every visit you come in, you're going to pay hundreds of dollars out of your pocket for therapies, not us. Once you
included.
pay for your allograft therapy, your rehab is included. And
Right.
because we want great results, not just a whole bunch of people who've gotten stem cell therapy but didn't get a good result. That
Right.
makes no sense. And so, we have a huge number of referrals now, people coming
Right.
in and referring their friends and family, and it's because they've seen great results.
Right.
And I think the proof is in the pudding.
For sure.
You go the extra mile and help the patient, it comes back to you,
Right. Well, that's what I was
Um,
going to say. And then we create relationships with these people.
Absolutely.
Like, my number one question when I talk to a patient is, what is your goal? And
Right.
I love when a patient tells me, like, Miss Linda, hey, Chelsea, I fixed my own hair this morning.
Right.
That seemed like such a small gesture to other people, but it just, to me personally, it just touched me.
Yeah.
Like, yes, she was able
mean-
to do something that she's been striving to do for so long, and now
Right.
with allograft therapy, she's able to do that.
She's able to do it.
Yeah.
Wonderful.
So,
And,
it's just,
people able to move and hike. What are the other things we see? We got one 85-year-old able to lift weights with his arm now, and before he couldn't even move it from his side, was told he needed a total shoulder replacement.
right.
And now he's able to even lift weights with that arm. He's not on any medication for it that I know of, and he was on lots before.
Right, and Mr. Dave, who couldn't move his
Yeah,
shoulder,
that-
and now he walks his hand up. He has to show us every time he walks that hand up the
Up
wall.
the wall, and able to do that.
Right.
And there's just so many stories, and I invite everyone to. Many of those are posted online, so check those out. Those testimonials are posted, and you can see when the patient's own words how they were before and how their life has been changed since the allograft therapy, and no side effects, not one side effect.
No.
So that's another thing that you can't beat that.